Hello, Medicare Advantage risk adjustment operators, innovators, and learners. Welcome to another learning series of the Hills Academy Risk Adjustment Made Easy, the Medicare Advantage kind. I am your host tutor, Dr. Prince Bewa. If today is your first time joining us, we want to say welcome. If you have been with us over the years and learning with us, we also want to say welcome and thank you for joining us. If you have not subscribed yet, I will encourage you to subscribe to our YouTube channel. Over this month, we have been going over the payment year 2018 overpayment run and looking at the HPMS memo that CMS released pertaining to this overpayment run. We have been taking that memo and looking at the other reference memos that are in this particular HPMS memo. In week number one, we looked at the August 29 HPMS memo, which was the payment year 2018 overpayment run, which has the deadline next week, Monday, September 30th, 2024. Week number two, we looked at the April 15th, 2022 HPMS memo, which CMS released to remind all health plans that are in Medicare Advantage their obligation to submit accurate risk adjustment data. Last week, we looked at the February 29th, 2024 HPMS memo, which is titled 2024 Risk Adjustment Reruns for Purposes of Payment Recovery, which CMS released earlier this year, informing plans of the overpayment runs that CMS intended to run in 2024. And all these videos are on the playlist. So if you have not watched them, I will encourage you to watch them to get a better context and also look at all these memos to get to know as a health plan your obligation to submit accurate, complete, and timely data to CMS. Today, we are looking at another reference memo that was in the payment year 2018 rerun memo. And this reference memo was released in March 15th, 2024, and it is titled Support for Use of Encounter Data in Overpayment Reruns. CMS released this memo earlier this year to inform Medicare Advantage plans of using encounter data in overpayment runs. And as you can see here on February 29th, 2024, which is actually the memo we talked about last week, CMS released an HPMS memo that is entitled 2024 Risk Score Reruns for Purpose of Payment Recovery. As discussed in that memo, CMS will be taking into account diagnosis deleted from the encounter data system. Encounter data deletes in the processing of overpayment starting this year. So this year, CMS started running overpayment runs that included encounter data. We have received a number of questions regarding how deleted diagnoses are reported back to submitters. So this HPMS memo is actually given much more context to questions that CMS had received. As part of our efforts to respond to these inquiries and support Medicare Advantage organizations and other entities that submit risk adjustment data, CMS is sending this memo to describe how to identify deleted diagnoses using CMS's report. This memo actually gave much more knowledge and context in terms of how one can use CMS's already existing reports to identify, delete on-encounter data records and chart review records that will be leveraged in overpayment reruns that include encounter data. And this video summarizes content of this memo as you see on the next slides. So this memo covers several areas that plans need to take care of. At a very high level, this memo informed plans that CMS will include diagnosis deletes from encounter data systems as part of processing for risk adjustment overpayment. Also, the Medicare Advantage organizations need to understand how to identify these deletes using CMS's reports such as the MAO 002 and the MAO 004 reports. And the memo also provides examples and scenarios and other resources pertaining to how submission errors can be identified and how that may affect the Medicare Advantage risk adjustment scores, overpayment status, and how organizations can avoid these errors. And those are some very high level of this memo. And CMS also gave the health plans, some resources on the CSSC operations website, including submission scenarios and also guidelines on the MAO2 and MAO4 reports in helping organizations to better identify these diagnoses that are needed to be deleted as CMS processes risk adjustment overpayment. And the implication of this memo is that the plans should submit accurate data. MAOs must continue to submit encounter data records, including deletes, even after the final risk adjustment deadline, which is what, for example, with the payment year 2018 deadline to submit deletes coming up at the end of this month. And also, MAOs may use the MAO4 reports on the MAO2 reports to track risk adjustment eligibility and identify diagnoses that are in add or delete statuses, and also help to determine if any diagnoses have triggered some overpayment that a plan needs to clean up. And deleted diagnoses that are the only instance of a condition triggering an HCC that may result in overpayment recovery needs to be deleted accordingly to CMS guidelines. That is, from a high level, the content of the March 15th, 2024 HPMS memo. As we end, I want to invite you to the Hills Academy website where you can download free resources at www.thehillsacademy.com/resources. And here it's just a screenshot of the website where you can download some free resources. If you are not on our email list, I will encourage you to also subscribe, and you get our signature gift, which is From Chaos to Clarity, the essential Medicare Advantage risk adjustments data sources comparison cheat sheet, which compares all the data sources that are used for Medicare Advantage risk adjustment in a very simple and easy way for you. Thank you so much again for joining us, and thank you for spending the time with us. If this has been helpful, I will encourage you to like, to share, to subscribe so that it can get to a wider audience. Thank you for spending the time with us, and catch you again same time next week as we start a new episode. Bye for now.